Hi, I'm Josh Ratner, and welcome to Health Alliance and You, a health and wellness series brought to you by Health Alliance of the Hudson Valley. One of the fastest growing specialties in medical care is hospital medicine. It is a relatively new discipline concerned with the care of acutely ill, hospitalized patients. Doctors focusing on this are known as hospitalists. Health Alliance is lucky to have Dr. James Corsones as one of our hospitalists. Dr. Corsones is board certified in internal medicine and a long-term doctor in our community. He'll explain what a hospitalist is and how they can benefit you as a patient.
A hospitalist is a physician that works exclusively in the hospital, taking care of patients while they're in the hospital. The trend in the country currently is a lot of physicians that work in the community for a variety of reasons, efficiency, business, etc., don't come to the hospital any longer. They may only have one patient and they're traveling 30 miles to come to see one patient. So it makes it hard for them to do that and also be available for all their patients in the office. We have a group of physicians who work for the hospital who will take care of those patients while they're in the hospital. And the goal is to provide efficient care while they're in the hospital to try to keep their length of stay shorter. And we communicate with their private physicians so that they know what has happened to their patients while they're here. The trend for hospitalist medicine started about maybe 15 or 20 years ago. I'm not sure if the hospital started it or physicians started it. The initial push behind it was to create more efficient care and to shorten hospital length of stays. Since we're based in the hospital and we're here physically throughout the day, if we order a test and it's not done till, say, early afternoon, we can still follow up on that test. And once we know the results of that, if we're allowed to send the patient home that same day with the result in hand, then they've gotten better care in a more efficient manner. The scope of the hospitalist work is almost exclusively with inpatients. We do go to the emergency department to admit someone to the hospital, but the evaluation in the emergency department is done by an emergency physician, which is a separate group. If someone comes as an outpatient for a procedure and has a problem, we may be asked to get involved to help in the acute care of that person while they're here, but we do not care for outpatients. And once they leave the hospital, they go back to the physician that they had before they came to the hospital. The benefit of being here all the time is we develop relationships with all the different departments. So we usually can get tests done more quickly than if you just ordered them from the outside. We also know the patterns of the specialists, when they typically come to round in the hospital, how to get a hold of them, and coordinate the care in an easier manner. It's easier for them to get a hold of us because we're already in the hospital. They don't have to try to call an office, go through the voicemail that every office seems to have now, and then try to get the doctor who might be in the room with the patient. So the familiarity with being here makes it easier for me to get tests done in a more timely manner. And the more you do it as being a hospitalist, the more you understand what's important to do while the patient is here and what things are better left to be done by the doctor in the office. I think when people come to the hospital, they're naturally going to be a little bit scared. They might be sick. They've maybe never been in the hospital before. And it can be a little disconcerting to them to see a strange face and say, I'm your doctor, I'm going to help take care of you. The way we try to overcome that is, I was formerly in private practice, and I did that for 28 years. So I'm very used to that sort of relationship. And I try to make the patients feel as comfortable as possible with me. I try to get to know them a little bit on a personal level as well, and try to make it not so serious so that it relaxes them and they can open up to me, and then I have a better idea of where they're coming from. It makes it easier for me to take care of them. The plus of being the hospitalist is that we're here throughout our entire shift, so that if family members come in later in the day, or as I said earlier, tests that are done at a certain time, we can actually follow up on those and give them almost instant feedback on those tests to make them feel more comfortable.
We hope you found this edition helpful. Remember, there are many advantages to having a hospitalist care for you. So the next time you or someone you know is admitted to the hospital, rest assured the hospitalist has the qualifications to provide you with optimal care during your hospital stay. For more health information or to view this episode again, visit hahv.org. I'm Josh Ratner. Join us next time for another edition of Health Alliance and You for details on how to stay healthy.